Assalamu alaikum, Day Communication Day. First scenario, Mr. Hussein was admitted after an episode of severe sudden onset headache followed by a collapse at his office. He has been taking thiazide for hypertension for many years. Few months ago, he developed DVT in his leg after a long flight and was prescribed warfarin for 6 months. On arrival to the emergency department, his blood pressure 160 over 100, sorry, and INR was 4. CT brain confirmed subarachnoid hemorrhage. Mr. Hussein has been brought up to the ICU for ventilatory support as he has been deteriorating since then. The effect of warfarin has been reversed with treatment. The CT has been reviewed by the neurosurgeon, and the hemorrhage is too big to be performed in a surgical intervention. Surgeon decided that there is no there is no hope for surgery, and the medical team decided end of life care. Your task: discuss the situation with Mrs. Hussein, explain the management plan, and address any concern.
Okay.
You ready now?
Yes.
Okay.
Hopefully.
Good luck. No worries, just focus again on the task and best of luck. Here you go.
Hello.
Hello.
Yes. This is Dr. Abdurrahman, the doctor in charge today. Can I confirm that you are Mrs. Hussein, the wife of Mr. Hussein?
Right, I am doctor.
Yeah. Welcome, Mrs. Hussein. We are here today to discuss some issues regarding the health of your husband, Mr. Hussein. Is this okay with you?
Yes, doctor.
Okay. Do you want anybody to be with us in this meeting?
No, doctor, I'm okay.
Okay. So, Mrs. Hussein, can you tell me before starting our meeting today, our discussion today, how much do you know about the health status of Mr. Hussein?
Just doctor, he had a sudden onset of headache. Okay, and then he passed. He had a collapse on his office. They say that he has bleeding in his brain, and he was admitted, but I didn't know what happened to him.
Okay. I appreciate your knowledge about the health condition of your husband, Mr. Hussein, and I'm so sorry for what happened to him. What do you expect from our meeting today?
Really, doctor, I just want to know. He before he had a clot in his leg, and he is going on medicine, blood thinner medicine. Is this the cause, maybe?
Okay, your concern is very important. Thank you for asking this question. Yes, actually, let me just recap for you what is going on with Mr. Hussein, explaining the situation as general. So, Mr. Hussein, as you said, he has a clot in his leg a few months ago. As a result of a flight, and in the background of his condition of high blood pressure that he's suffering for many years before. And he has been treated with a medication, a blood thinning medication, and he was taking this medication regular. And as explained to you before, any medication has side effects sometimes and bad outcomes sometimes could happen. It's not happening for everyone, but it can happen. One of them is more thinning of the blood, and it might cause this bleeding. It is a possibility that it's the cause of this bleeding that happened in his brain now, and that causing for him the collapse happened in his office. Are you following me, Mrs. Hussein?
Yes, doctor. I'm following.
No. Okay. So this is the condition when Mr. Hussein came here in the hospital, and he has been admitted with us and evaluated, and his respiration was very bad. That's why he was put in the a machine to help him breathing in the he is admitted, of course, in the high dependency unit. That is the place for serious condition, and he's put on a machine called ventilation to help him to breathe. And the good news that his the blood thinning medication effect has been reversed, but unfortunately, after evaluation of Mr. Hussein, the blood in his brain has been found very big that it could not be operated on.
What, doctor? What did you say? So you will let him die?
Mrs. Hussein, I appreciate your concern, and I can just imagine how difficult this for you. But the situation that I have to explain to you in a very clear way, that he is this bleeding was so huge that the surgeons, after evaluation, decided that they cannot operate on this bleeding, and unfortunately, because of his condition is very advanced, the medical team, that is the treating team, decided there is nothing left to do for him.
Doctor, what you say? There is nothing left to do? No surgery? Nothing to do to help my husband?
I'm so sorry for
You
that.
leave him die like that?
No, we will not leave him die. We will continue caring for him, but there is nothing to cure his condition can be done now, and his condition is very advanced that it might not last for long now. I am so sorry for this news. I can feel your feeling, and I just can imagine how much difficult this for you. I need to ask you if you know any wishes, or if Mr. Hussein expressed any wishes before, or any thing that he explained to you when his condition deteriorated or worsened, medical condition, what he is wishing to do in this situation.
Doctor, he didn't talk to me about something like that.
Mm-hmm.
I'm really surprised.
Mm-hmm. I'm so sorry for that. So now, because of the deterioration, and because we need to make his last hours very comfortable for him, the team decided that they will give him something called end of life care. This actually a type of care where we aim to make the person very comfortable in his last hours. So any passive treatment, any treatment that could affect him or give him pain or something will be stopped, and we will care about making him more comfortable more than anything else. Did you get my point, Mrs. Hussein?
Doctor, he will not take any medicine?
Mm-hmm. So he might take some medications for his pain, to make it comfortable, as I told you, but he will not take anything that can elonging his time and make him live more in suffer or in pain. Like
okay, doctor.
the
2 minutes
machine
left.
that's supporting his breathing like if his heart stopped, they will not do like the compressions to make it come back. So, Mrs. Hussein, do you have any other concern for me?
Just how long does he have, doctor?
Okay, this depends on his situation now. Nobody can know how much he have now. But I recommend you to, if he has children, do you have any kids or any, he has any brothers or family, that it's better to tell his family to be with him in this time.
Okay, doctor.
Okay.
I will tell him.
So, yeah. Do you need any other support from me or any other questions that I can help you with?
No, I'm good, doctor. I'm good.
Yeah. Yeah. So again, I'm so sorry for what happened. Appreciate the condition that you are going through, and make sure that we are here all with you.
Okay, doctor.
Okay.
Thank you.
Finished or not yet?
It's still 20 seconds. What
لسه
you want
ممكن
to offer?
أي social support.
The surrogate is very,
I'm
very
okay. I'm
calm.
not good. I'm okay. I'm sorry.
Okay, yeah. So yes,
You
and
can offer also.
yeah, I asked about consent. Ventilated support, I told that we will stop. Yeah. What else?
Very calm. You want to add? Yeah, anything you want to offer? Sure.
Offer brochure, leaflets.
Yeah, little brochure
Yeah,
website about end of
yeah,
life
yeah.
care.
I
You
can
can
give
read
you some
about.
brochures and yeah, with website to read about this end of life care, and to know more about this condition. It might help you dealing with this situation. Is it okay with you?
Okay, doctor. Okay, thank you.
Okay, time is up.
Okay, thank you.
Perfect. Well done, Dr. Salama. Let's see Dr. Sakinam comment, then I will come.
Yeah, I really think that I can never do a scenario like this.
No, no,
Indeed,
you did good.
hopefully you
You
did
did good.
good.
Yes,
You did
you
good.
did good.
I just read that we have not, we don't have to mention about DNR in this situation. It is controversial if it is written in scenario or no.
Yes, I heard before one mentor said if the surrogate situation allow you to do so. يعني sometimes the surrogate will be very ما شاء الله تبارك الله, you are very calm, but sometimes the surrogate will be very upset about the thinking that it's error. So no, why you give this medication? Who give this warfarin? And no, doctor, I will complain. In this situation, I will not ask about I will not mention the CPR, the do not restate. But if the surrogate accepted and was calm, then I will explain about all the things يعني of end of life.
Briefly. Yeah, briefly. In
Briefly.
one sentence only, yes.
Yeah, briefly. I said only the things that
Yes,
can
exactly.
support and elongate his life will be stopped. Like the breathing machine, like if his heart is stopped, we will not do compressions to make it come back. But others we will do. I told,
Okay.
yes, I told the call family members. Yes.
بس also when you starting for Breaking Bad News, you just a little bit late. Like, okay, I disturb you with my concern when I'm asking, is this because of the medicine or is this because of the warfarin? You maybe disturb it because of my question.
Yeah.
But I think you had to start with the Breaking Bad News first, more than this, early more than this.
Okay, thank you for the comment.
بس all of بس يعني well
Yeah,
done دكتورة
let's check in.
تحفة
Yeah.
يعني I'm a beginner
شكرا.
surrogate فأنا برضو
No, no,
I'm not
no.
good as a surrogate.
No, no, you did great as
This is
surrogate,
my
Dr.
luck.
Zakilan.
This is my luck.
No, no, but she did great as surrogate, really. She did well.
Yeah.
You are perfect as a beginner and as a first practice, Dr. Bakilan, to be a surrogate. It's a good opportunity. keep going, and
Thank you.
it's like that. You have to start,
Yes.
break, and overcome this point. Don't stop there,
Okay.
okay?
Okay.
This is the first thing. The second comment for Dr. Salma, yeah, the introduction was good, the confirmation. I prefer to ask her, how can you, or how you prefer I call you today, or how can I address you today, rather than saying Mrs. Hussein. You can ask her
Okay.
name, okay? And the next of kin, of course, for any scenario, you have to confirm this. Are you the next of kin? Because you are going to break a lot of bad news and you will talk about his points of confidentiality. The good thing you invite someone to attend because you are going to break bad news. So the introduction was good apart from the next of kin point, okay? Then, yeah, the background you ask, the expectation, which is also good. Then the explanation and the debate of is it a mistake or not? What do you think, Dr. Salma? Because I felt you are hesitant. You were about to say yes, it was related to the warfarin.
No. I wasn't about to say that, but I was concerning. I heard the scenarios like this. The patient was debating about this is a mistake. So I was afraid that you will do the same. That's why I was concentrating to tell her every drug has side effect. Dr. Basim, this is maybe my third or fourth time to practice with you, but still I'm having palpitation. That's why you feel like I am hesitated.
Audience a lot. Audience make a palpitation.
Yes, that's
Dr.
why.
Salma,
But yeah,
let me assure you, if you have palpitation
yeah.
now in the exam, you will have triple palpitation.
Yeah.
Triple
Really?
the pulse rate, really.
الله يبشرك بالخير.
That's why we
Okay.
are practicing a lot. You have to
Yeah,
practice a
that's
lot.
right. Yeah.
In the exam, no limit for the stress. And
Mm,
if you remember now the things and the points you will discuss and talk
mm,
in the exam, believe me, most of the
mm.
points you will miss because of
Yeah.
stress. And once you finish the exam, you will see, oh my God, I didn't raise this issue. I didn't ask this question. I didn't do this step.
Mm,
So you
mm.
have to practice a lot. It's a
Yes.
matter of how to control your stress in the exam.
Yeah.
Okay.
The other thing in the scenario, the INR was mentioned. It was 4. When I was reading the scenario, I was thinking why they mention it. Everything mentioned in the scenario mentioned because of something.
Yeah,
So
you're right.
yeah.
But I believe if it is an error, they will explain it clearly. It was related to an error, and
Mm,
the task will be related to
mm.
apology about this error.
No,
But
it didn't come to my mind. It's an error,
yeah,
but
perfect.
yeah.
So
But
you
I
have
was thinking how to use this INR. Then,
okay,
if she debated, maybe
exactly.
it will
I
be in
think
use.
about the discussion, according to the
Mm,
Yeah,
discussion.
according
mm,
to the discussion, and as you said, the good thing we corrected it. But
mm,
there is
mm,
another factors it could
mm,
be
mm,
related to. Okay.
mm.
It
Yeah.
will,
Oh,
because of hypertension, may be related to hypertension. So it's not one or
Mm,
single factor related. It might
mm.
be multifactorial. So
uh,
don't,
Okay.
yeah, go ahead, Dr.
Mm,
Bekele, what you want to say?
just I
Because this
had
is your
a
scenario.
comment. I had one comment. I forgot about it. I felt it inappropriate to say, okay, I already gave the warning shot when I'm saying, do you want someone to attend with us the
mm,
meeting? And then, okay, I have a good news that we reversed the action of the warfarin. I didn't feel it the best sentence
Ah,
here.
okay.
It's
yeah.
like,
I
يعني
felt
حسيت
like
okay.
you. I said
صح
it, but I felt like
اوكي
you. Yes, that's right.
تمام بس قلت
Yeah.
اقول لك عشان
It should.
يعني
Yeah.
ناخد
لا
بالنا من
كلامك صح.
الحاجات دي. اه
لا
just
كلامك
take
صح.
care.
أنا
Yeah,
بعد ما قلتها على طول I
it
decided
shouldn't
that
be,
I should
yes.
not say like that. Yeah.
It
I
shouldn't
should.
be. And if
Mm,
she asked you, Doctor, do you think it is related? You can talk it as an honest point and duty of candor.
mm,
Yeah, he came with high bleeding time or high bleeding or thinning effect of this medication. However, we
mhm.
corrected it. Okay.
However, we
But
corrected it.
you don't,
Yes.
yeah,
Yeah.
you
In
don't
the
have
general speaking, yes,
exactly,
that's
you
right.
don't have
Yeah,
guarantee this
that's
is the
right.
main the main cause of his bleeding because he has hypertension.
الله
Okay.
يلهمنا الصواب يوم الامتحان.
Yes, this is the best pray ever.
Yeah.
How
Okay.
to get it, how to talk about it, and to be cautious, how to talk and what to avoid. If you mention one point or one sentence in a wrong way, the examiner will judge on this word.
Mhm.
Okay.
Oh.
Anyone was
Okay.
talking? Sorry, I interrupted someone. Dr. Buckingham or someone else?
Oh, yes. I had another
Okay, go ahead.
debates. We
This is
had
your
another
scenario,
debates, but
Dr. Buckingham. Yeah.
not in this not in this scenario. Another
Okay.
scenarios, but we decided to talk on the group. The scenario with bed sores, okay, and
Okay.
also the scenario with endoscopic and perforation,
Mhm.
okay. What is the difference between medical error here and negligence and just complication? We cannot differentiate.
Which scenario? The bed source?
Bed sores considered after 1 week from stroke. The relative say there's a nursing there is a nursing problem.
Yes,
Okay.
yes, I got it. Okay.
This scenario
So,
and the other scenario with the endoscopic.
okay. So, in order not to confuse others, let's talk
Mhm.
about these 3 points after the whole practice, I
ماشي.
mean the
Okay.
session, okay, at the
Okay.
end.
Okay.
This is the
Okay.
first thing.
I will send the
Yes.
scenario for you. By the way, the scenario
Yes,
is like your scenario. It is
And
not.
the flat care.
send the scenario and Dr. Buckingham will
I
get
will not
ready
tell
and
you.
I will
Okay.
Read the scenario.
Okay.
I
On
will
the chat.
comment on other point, Dr. Salma, because I didn't finish the comment because you said respiration and you said another word for the
Breathing.
jargon. So yeah,
Yeah,
breathing. Always you remember it after you finish. I know that.
yeah. I
Compression also,
corrected it
yes.
after saying it. Yeah,
Yeah,
respiration.
the
Then I said
compression
his
also.
breathing. Yeah,
The compression you
compression.
can say heart massage. Okay,
They
heart
said
massage.
don't say heart massage because it's not massage. Massage is a benign word. Massage is massage.
So what about compression? It's
They
this is
said
what I
yeah.
know.
No, I don't know. But I heard many people say that don't say massage because massage is a benign thing, good thing, but it is compression because you are trying to make them afraid of it. So it is just compression that can result in ribs. Massage will not result in rib fracture.
But you are doing heart massage, not body massage. Anyway, we used to say it in this
Yeah,
way. Okay,
yeah, I know
we used
that.
to say it in
Yeah,
this way. Anyway, either
Mhm.
to say it and to explain, this is the
Yeah.
action we do
Mm.
usually if the heart stop beating in order to resume the activity of the heart or the beating action of the heart or the pumping action of the heart. However,
We
in
can
his
say
condition,
bushes, Victor. We can say bushes
pushing,
Bushes,
or bush.
yeah,
Yeah.
thank you. I think I revised this in NHS and
Mhm.
I didn't find massage. I find them using compressions. That's why I agree with that people. I
Okay,
didn't find the word massage, but I
Yes,
will
okay,
bush
revise it again
better.
after this.
Mm.
Yeah, bush is
Bush,
in the
yeah,
middle.
bush.
Yeah, yeah.
okay. Maybe push on the heart. Okay, it's okay. I also can be like this in a simple way. Again, it's a simple explanation. Be simple as much as you can. Yeah, the next point I wanted to raise, yeah, you invite someone to come to see him at the last moment, but I want you to be more honest when she asks you for how long he did or will he die? Yeah, will he die? And
Mhm.
you answer her, no, he will not, right?
Sometimes end of life care can take up to 24 to 48 hours.
But he
And
will die
in
later,
yeah, he will
soon or later he will
I
die.
told yeah in the last hours. So the one time one debate came from the surrogate that can you just keep can I tell my brother to come his brother
Yes,
to come, yeah, and see him tomorrow. Can you
yes,
keep the ventilation up to tomorrow? Then
yes.
the answer was yes.
We will
Yes.
try our best, but
We will try
sometime,
our best.
yeah,
I will go back
sometime.
to the treating team and tell them
Exactly.
about your wish,
Perfect.
and we can see what we can do. It's better to tell his brother to come. This will be
Yes.
very good for him also to be with him in his last hours.
Perfect.
That's
So
that's why I didn't say he has hours.
no,
I
I'm
said,
not talking about the duration.
yeah.
I'm talking about the question of will he die? She asked you, will he die, doctor? And you told her, no, he will not. I remember like this.
Doctor, no, my
Yeah,
question
okay.
was how long he will live.
How long he will die? I told her
Mm.
nobody can
Ah,
decide
okay,
when he
okay.
will
I
die.
misunderstood. Okay,
But he is in his last hours. I told like this.
okay,
This is
okay.
my sentence.
No,
Yes.
there
Okay,
was another question, Dr. Salma.
yes.
Will you let him die? You told her no, we will not let
Yeah,
him
this is,
die.
yeah,
Okay.
thank you, Dr. Maha. Thank you, Dr.
Another
Maha.
question.
This is the
Welcome,
one.
Yeah.
welcome.
This is the
Okay,
previous one. Okay.
yeah, this is the one, Dr. Maha. Yes,
Yeah.
actually, this is the
Actually,
question. Yeah,
here I was hesitating. كويس
no,
يا
no,
دكتور
no.
Maha. You remind me to ask Dr. Basim. Yeah, what they
Yeah,
will do in end of life care?
yeah.
What component?
Yes, this is the main task. End of life care, even the ventilator, they withdraw the ventilator, although it's not written there, but
Yeah,
we will
I
not.
told her.
Yeah, yeah,
We will stop
perfect.
the
You told her.
ventilator. Yeah, but any medicine that she asked me, are you going to give any medicine? I told her the
The
medication to
only
relieve
medicine,
his pain,
yes,
to make
exactly.
him comfortable, but not to elongate his life. But
Don't say
I don't know.
not to elongate because it
Mm,
means you are negligence or
mhm,
doing some negligence. So the best
mhm,
To
answer
extend
is,
his suffering.
yeah,
mm,
we
mm,
are
mm.
trying to maintain his dignity. We don't want him to suffer more. That's why
Okay,
we are keen to give him the medication that let him die in peace
in
and in
peace.
comfort
Okay,
way. Don't say I
okay,
will not give something to elongate his life because it means that you want him to die or you let him die.
okay,
Okay, and when she asks
okay,
you, doctor, will you let him die? Please be honest and say it clearly. I'm sorry and I'm afraid, sadly. If we do what we are doing now with him, the end of life care, his life will be more short than expected. So you didn't say I will let him die,
yeah,
and you
perfect
said,
sentence. Yeah,
yeah, he might die after a couple of minutes or couple of hours or whatever the time, but we don't know when he'll die. But don't say
okay.
it clearly, and don't
Mhm.
also give a twisted answer, which is away from the die. Yeah, he will die. Okay.
He will die. Okay, okay, clear
This
now,
is,
clear now.
yeah. And the
Yeah.
end of life care, as you said, to maintain the dignity, we don't want him to suffer. We will
Mm-hmm.
try to make him calm as much as we can. The most important medication here is to keep him pain-free.
Pain free. Okay,
Yeah. And this is the
okay.
only medication given to end of life care. Apart from this, they might give IV fluid through the
Mm,
blood channel, some fluid
okay,
through the blood channel,
okay,
oxygen. But if
okay.
there is ventilator, as you said, they might disconnect the ventilator
Mm-hmm.
there in Europe. I don't know. Here we are not doing that. We are not withdrawing oxygen or the ventilator. We might titrate or taper down the oxygen,
Mm-hmm.
okay, but we'll
Okay,
not disconnect. This is
okay,
here in Gulf, but outside they are disconnecting.
okay,
So this
okay.
is
Clear for me
yeah,
now.
this is the point about the end of life care. The time, as you said, don't give clear time because it's not written. But if written, you can say it clearly. It's 10 minutes or hours or sorry, minutes or hours or days. Say as written in the scenario. If she said if they written there, it might be couple of minutes. Say couple of minutes. If it's written hours, hours. So according to your scenario. Okay. And for the point of living wish or advance directive, did he express any living wish or when he was okay that he want to be receiving this care regarding the medical management? If she said no, that's okay. If she said yes, try to respect it. Yeah, we respect that. And I appreciate your wish and your father or your husband wish. And I will update the team about this wish. For example, if he wish to be die at home, yeah, we respect that. although it's not applicable in this scenario, but I will update the team and we will see how can we do with this. Okay. This is regarding.
But if she said he wished to be ventilated and
Yeah.
saved, I will
So
tell her this is a medical decision in his
exactly,
best
yes.
interest. Okay,
Yes.
okay, clear now.
Yes.
Clear.
Okay. Okay, Dr. Buckingham, your scenario, melanoma. Your role, you are the doctor in the medical outpatient. Mr. David, 40 years, he was diagnosed to have malignant melanoma 10 years back, removed completely, and then discharged back to the GP after 5 years. After 5 years follow-up, now referred with right upper quadrant discomfort and not responding to PPI, proton pump inhibitor. Recent loss of weight, liver function test shows cholestasis, and ultrasound showed multiple lesions in the liver, enlarged para-aortic lymph nodes. Your task explain the condition and answer his concern or questions. I will give you 2 minutes. We will have discussion about the previous scenario. Anyone has a comment? Any comment missed by us, please, he can add, or any question, unclear point to be explained. I will read the comment. Dr. Al-Rashid, better to break bad news early, then continue accordingly. Yes, I prefer same. And I prefer when you mention end of life care, like the same way we are breaking bad news. We decided to do what's called end of life care. Have you ever heard about end of life care? With warning shot, of course, and golden silence. And let her react. What you mean, Doctor, end of life care? Is it something bad? Is it something good? This is the way how to do breaking bad news in any task, including something related to breaking bad news. Of course, end of life care, clearly, the word is clear, end of life care. So it means you will end the life. So you can say it, and as breaking bad news, let the surrogate react, then explain it. Okay?
And
Thank you.
السلام
Thank
عليكم.
you, Dr. Rashid. Walaikum salam. Yeah, go ahead.
And I think برضه she need to highlight more about this severe يعني the advanced situation. It is very مثلا large hemorrhage like that. It will
She
not
mentioned
respond
this.
for any kind of medication and highlight more شوية عشان to accept this.
Yeah.
بعدين لما we mention end of life care and let المهم حتقبل إنه this observation يمكن.
Yeah. I believe she did some about that. She said that this big bleed, it wasn't okay to be removed. I think she did, even if briefly, but at least she gave this news. Okay, what about Dr. Rashid? Also, what about ventilator support? Are you going to remove it? Yes, we will. You did perfect, Dr. Suma. Yes, Dr. Aisha. Just add call family member. She already offers spiritual support. Yes, it's a good point to be mentioned. Virtual spiritual support for religious issue, and you can add also the bereavement team. Always remember this bereavement team who's
Spiritual, this is the second time I heard from Dr. Aisha, she mentioned spiritual.
yeah.
How we will say spiritual support?
Yes. Yeah, you can say we
I
have
think
here. Okay, go ahead,
okay,
Dr.
doctor.
Aisha.
Okay.
Who want to
No.
talk? Dr. Bakiram? Go ahead, Dr. Bakiram,
Oh, and
please say. Yeah,
I
go
think
ahead.
I heard from some doctor. He say, okay, if your father, if you know your father is a religious guy, we can ensure
Arrange. Yeah.
someone arrange this for him to help him in his last hours if he will be
Mhm.
happy
Yes.
about this or pleased about this.
Yeah.
This is first time I heard this. That's good. Okay.
Yeah, it's related to some beliefs like our religious, any patient
Yeah.
at the end of his life, we make Quran, read Quran for him. The same outside also there in Europe. So they have some habits. Whatever they want to do, we can arrange our team to do that arrangement. Okay,
Okay.
bereavement team as well. Someone to sit with your family to absorb their anger and to support them socially, emotionally, because of course all of these things are hard to be absorbed easily. Okay.
Okay.
Dr. Umaima also said, well done, Dr. Salma. I agree, Dr. Maha. Is she the next of kin? Yes, she missed this point. That's why we already explained it. Well, Dr. Ahmed Abdel Akhir. Yeah, well done. Okay, Dr. Bakinam, are you ready?
Okay, doctor.
Okay.
Okay, calm down and here you go.
دكتور في الآخر أنا I will be the one to do this scenario.
Sorry,
I will be the one to do this scenario.
which scenario? No, sorry, Dr. Ahmed. I read your comment about you want to
Yes.
do scenario, you mean communication?
Yes, I thought I am the one. Sorry.
No. I read your comment. Well done. But anyway,
Okay.
if you prefer or you want to do any scenario any day, just message me privately. Okay, at the same
Okay.
day of the same.
Okay, thank you. Thank you.
Most welcome, Dr. Okay, Dr. Bakinam, ready?
Okay, doctor.
Yes. Hey.
Hello, I am Dr. Salah. I am the doctor of the clinic today. May I confirm that you are Mr. David, 40 years old?
Yes, I am.
Hello, Mr. David. We are here to discuss some issues related to your health condition. Is this okay with you?
Yes, doctor.
Okay, Doctor. Okay, Mr. David. Do you want someone from your family to attend our discussion today?
No, thank you. I'm okay.
Okay. Uh, do you know? Can you tell me more about your condition?
Yes, doctor. I have this pain and severe pain actually, and I came here for treatment. They did some tests, they did some images, and I'm waiting for the news. What did they find? And is it related to my previous condition? Or I need to know what is going on with me.
Okay, Mr. Hafiz. Mr. David, I'm sorry. Sorry, بس أنا I'm
Your
sorry,
voice is
Mr. David.
interrupted.
Oh,
Mhm.
just a little bit. Okay. Yes, Mr. David. I'm sorry. I'm sorry for that. I don't have good news for you today.
Why, doctor? What is going on with me?
I appreciate your concern, Mr. David. The imaging you have been done
Mhm.
showed that you have already a mass from the on your liver from the previous cancer or nasty growth you had before. And also not only your liver, it is also inside your abdomen near to the blood conduit in your tummy. So it is like the condition become more severe. I'm sorry and I appreciate your feeling, Mr. David, for that.
Oh my God. So my cancer came back and it is now in other organs. That what you are saying?
Yes, right, Mr. David.
Oh my God.
I'm very sorry to be the one who tell you that.
Oh my God.
Are you
So
okay? Are you okay, Mr. David?
no, I'm not okay. I didn't expect that. That was 10 years ago. Are you sure? Is this my file? This my name? I thought it's just the food that I ate yesterday with my friends.
I'm sorry for that, Mr. David. The results have been confirmed, and the team already confirmed that you have been the cancer or the nasty growth have been recurrent.
Okay.
Do you
And
want tissue or something?
no, I'm okay. What are you going to do for me? You remove it again.
Your concern is valid, Mr. David. But this new cancer or new spread to organs like or in your liver and also in your tummy is means that it is a very progressed condition, and it is too serious to have a solution for it. But
So, doctor, there is no solution. I'm just 40 years old. I'm expecting to have a child in the next 2 months.
I'm sorry for that, Mr. David. I appreciate your feeling. I appreciate your feeling, and anyone in your shoes will act like that. But I'm sorry, this means that cancer is already spread in your body, and no, the team, the medical team, like see that there is no interfere available or suitable for your case in this situation.
So what are you going to do for me now? Let us be practical. What are you going to do?
I'm sorry to tell you that, but Mr. David, I think we will continue on the palliative care. Do you know about it? Do you have any idea about that?
No, I never heard of it.
Okay, let me explain to you. That as a team, okay, we will be in your in your care, and we will help you to go through about this period, but without any active treatment. We will just give you the supportive treatment you will need, and to be comfortable as much as we can.
So I understand no surgery. Are you going to give me like chemotherapy? I heard about chemotherapy.
Chemotherapy, also, I'm sorry for that, it's not suitable for your condition, Mr. David, because it is already spread on your tummy, and it will not be responsive to the other medications, and is also considered active treatment. What is palliative care is about giving you the support to be comfortable as possible, and to be to save your dignity in this hard days, hard period.
So you are saying that I have days now. I will die soon.
I'm not saying that. We don't know exactly what your condition.
Be honest with me, doctor. For how
I am
long?
honest, doctor. I am
For
honest,
how long
Mr.
I will
David.
live? For how long I will live?
I don't know exactly. It is variable. We don't know, but at least we will go to comfort you as much as we can, and we will give you the support you need, and anything you need in this hard time, we will support it to you. Any medication or any painkillers to ease the pain away from you, we will give it to you. And also, if you need any social support in or psychiatrist to talk with in this
Why psychiatrist? Why
stressful.
psychiatrist? Am I mad?
No, Mr. David, it's like to something to relieve your stress, not because madness or something.
2
Okay,
minutes left.
and also, if you have need any someone from your family, he can be with you in this time, or if you need spiritual support, also we can assure that for you.
For treatment, you mean?
No, for
My condition.
support.
Okay.
No, for support.
So I just need to meet your consultant. I think I have some options.
This is you right. This is for right. This is you right, Mr. David. We can arrange for you another meeting with my consultant. You had the right to seek another opinion, but we already discussed with as a team, and also I wanted to say to you that also there is a support group. If it is available, we can also arrange this for you. Okay.
Okay.
I wanted to ask you some questions, please.
Okay.
Are you okay to answer? Okay.
Yeah. Yes.
Mr. David, do you live alone?
No, I live with my wife. We have children. We expected to have another child in 2 months.
I'm sorry for that, Mr. David. Are they supported financially?
They supported financially by me.
I'm sorry for that. We can involve our social services and occupational services to help you through this and help your family.
I appreciate that. Thank you.
Okay, Mr. David?
Okay.
Okay,
Mr.
time is
David?
up.
End her
You,
suffer. End her suffer.
yeah,
بسرعة.
time is up. I can feel that, yes. But
Yeah.
you did well, Dr. Beckham. Really.
Yeah, you
But
did
if
well.
if I add 2 minutes or 1 minute or 30 seconds, what you will offer?
Other than I didn't ask about the wishing أنا كتبتها والله.
No, forget it. 30 seconds only
والله
or 20 seconds. Okay, what's important here?
here social anxiety, social concern. What's your concern? Any other concern?
Okay. What
لا
about leaflet brochure?
ماشي ما أنا تهت في
Okay,
السبورت جروب
no
ونسيت
problem. No problem. So at the end, before ending the scenario, offer some leaflet about the topic. Here you will offer
أيوة
some leaflet brochure about the palliative therapy or
أيوة
palliative
contact
treatment.
number.
Yeah, provide some contact number if you need any help. Any inquiry, please don't hesitate to call us. Okay, well done, Dr.
Okay.
Beckham.
I
And
just
first
reminded
time,
Dr. Salama with this
Selma.
and I forgot this.
Salma.
Salma, sorry.
Selma.
Salma.
No
Okay.
problem. It's okay, Dr. Beckham. As a beginner or as a beginning, it's great. So let's hear Dr. Salma comment, then I will go
Okay.
ahead, Dr. Salma.
Yeah, okay. So I think your problem that you didn't explain palliative well. This is the main problem. In order to explain palliative, firstly, you have to explain the condition of the patient, how worse is it, and the disease is metastasized like this. And when he asks you, are you sure this is my name? Firstly, you have to reassure him that we double check the names and we know that it's your name, and then move on from this concern, because it's very important for him to make sure that this is his name, because his previous cancer was 10 years ago, so he don't believe that the cancer returned back again. That's why you need to mention for him in a clear way that we double check your name and this is your result. Then after that, the condition is very advanced, and you can I don't know, I like drawing. Some people here they don't like drawing, but I like drawing. If you feel like it will waste your time, it's okay, but if not, then that your problem now in the liver and in the abdomen, he will make sure that it is metastasized to different sites or different places. That's why it is cannot be operated on. Your previous one was confined in one place, and that's why it was treated. But now it is metastasized to different sites. That's why it is no surgery for it. When he asks you about the surgery, then after that, chemotherapy. Chemotherapy could be part of palliative treatment. It's not an end of life care. This is different. Palliative can go on for years. That's why for more time, the patient is not going to die like end of life care. tomorrow or in a few hours. So chemotherapy could be a part of the treatment. That's why when he answer you, it's chemotherapy could be part of palliative treatment, but it will not be used as a curable treatment for your condition, but it will be used as a palliative. That's to say that it could be part of care to improve the quality of your life. So the palliative treatment, how to explain it, Dr. Aisha wrote it here very clearly. Just memorize what she wrote. Is an approach that improves the quality of life of the patient and the family, both. Okay, and it's not aimed to cure the condition, but the aim is to make the quality of life of the patient and his family best or better. Like then you can say that if there is pain, we will treat your pain. If there is any like supportive treatment, but no cure for your life. So any problems that you are facing or your family facing during the care of you, palliative care will take care of it, but
Yes, okay.
not curing your condition. This way will be reassuring. And I don't know, طبعا أنا also beginner like you. Maybe Dr. Bass in a minute will explain more words for you, for me also to
لا
use.
شكرا دكتورة فعلا كيس حلو أوي. Very good
Okay.
case.
Okay.
Thank you, Dr. Salma. You explain it well and briefly. It doesn't need to be more detailed. Pain-free, infection-free, depression-free, and dehydration-free. Just remember these components and try to talk about them. Pain-free, of course, will offer painkiller. If you have any infection, we'll provide you with some antibiotics. So we are supporting you. Okay? Infection, if you have infection, if you have depression, we can refer you to the mood doctor to help you to cope with the stress and the mood and of the cancer. Because any patient have any disease, not only cancer, even flu. If you have some flu, you feel like something different, like you are not in the mood. What about cancer? So it's something you need to be reassured with mood doctor. Okay, not psychiatrist, Dr. Beckenham. Don't say psychiatrist or say.
mood doctor,
So,
okay.
mood doctors. If he said, no, why do you think I'm mad? Tell him, no, it's not a matter of mad. The mood doctor is not only concerned to sit with mad people. He's concerned also to sit with people with stress condition, stressful disease. We know that you might have some low mood because of this cancer, so he can support you, sitting with you and talk with you. Okay, this is the way how to convince about the mood doctor. And the dehydration, if he has any problem with the of course, low appetite. So we will be sure that you are taking care of your power and your intake, either by any way, oral or IV fluid, according to his dehydration or hydration states. So you can talk about these parts within 2 or 3 minutes. This is the task, palliative. And the good thing here, Dr. Beckenham, you catch the task. It's not written outside, but you know it's a palliative management, and you talk about it.
But
Yeah.
I didn't differentiate between the palliative and the end of life care.
I will tell you
Yeah, you
something.
mix.
This
You mix
scenario
both.
sent for
Yeah.
me by a friend. She said her friend have 7 in this station only
Oh my
because
God.
she didn't mention palliative
Oh
at
my
all.
God. Oh my God.
Okay. Fortunately, she passed the exam, but she got 7 in this station. Alhamdulillah, she have good degrees in other stations, but only in this because she didn't mention palliative.
Hmm.
She told frankly, I didn't mention palliative at all. I just
Yeah.
break the news.
Hmm. So any
That's why
cancer
she
with
failed this year. Yeah.
yeah,
So
any cancer with
you did
advanced
very well.
metastasis, yes, you
Yeah.
have to
Thank
raise
you.
this word and to explain it, not only. And I like the way you said, do you hear about palliative? Yeah, this is the way how to explain something new. This is the task. Yes. Have you ever heard about palliative? That the medical team or the team treating you decided for what's called palliative therapy. Have you ever heard about that? No, doctor, first time for me to hear about it. What is the palliative? Now, this is the time to explain the palliative. Palliative care, it's something including group of doctors and some specialists and nurses. They will follow up you. They will give you the maximum support, the maximum care that you need in the next days. And they will be sure that you will be pain-free, dehydration-free, infection-free, depression-free. And together, all of them, they will be the one managing you in the coming days to be sure that you don't have any of these. So the end of life is not here. You mix, you put end of life with it.
صح.
And
Yeah,
yeah,
right.
whenever you want to offer support to the family, don't offer the financial. Again, don't mention financial. They need, yes, I know they will need support as financial, but now he needs something about his social support and
هو أنا
leave the
سألت
family.
I asked
Yes.
about the financial but I offered
Mhm.
social and
Yes,
occupational.
exactly.
بس
Perfect. Yes. But don't ask as a question, as a clear question about financial, don't ask it. Who's living with you? You said how you assume he's living alone. This is also it's a irritating question. Don't repeat it, okay? Don't say to him, do you live alone? Why you are saying do you live alone? How do you
with
know
whom
that
you
I
are
live?
living.
Yeah, with
Yeah.
whom you are living. Who's dependent on you? But don't assume something which you don't know. Yeah. Do you live
Dr. Basim,
yes.
if we tell, I was wondering, if we
Mhm.
tell the patient that because his main concern that he will not see his child, who is going to be delivered in 2 months. So if we said, I believe that we should answer every concern. If we said
Yes,
that
sure.
palliative care could be going on for time that we
Months.
cannot say
Yeah.
for sure when.
Yes.
So you might have a time to witness the delivery of your child, but not give him false hope. Just
Yeah.
we say that you might have a time to witness the delivery of your child and to enjoy him.
Yeah.
We don't know if you cannot do so.
Yeah.
So can we say that?
Yeah, it's okay to mention that. And also
Mhm.
for the question, for how long will I live? There is an answer also. You can tell him always, and usually the cancer shorten the life of the person who has cancer. Unfortunately, it differs from person to person. However, we don't know exactly what the nature of this cancer with you. So it
Perfect
might
answer.
be, yeah, from maybe weeks, even 2 years. He might live longer than he expected and you expected because it's cancer and you don't know what the next plan. And the next point, you mentioned no chemotherapy, Dr. Makina. Don't judge by yourself. If written in the scenario, nothing can be offered, chemo or whatever, you can say it. But don't judge, there is no chemotherapy. There is what's called chemopalliative or palliative chemotherapy. They can give him medication to chemotherapy, I mean, as a palliative. They can do some surgery as a palliative. They can do radio palliative. So don't
Yes, right.
judge on the
Okay.
things by
Yeah,
yourself.
I thought it's wrong also.
Yeah, it's wrong. Don't
Yeah.
say it again.
Okay.
If he asks you, there is chemotherapy, okay, I appreciate your knowledge. I appreciate sharing this with me. It's good to know about that. However, we will update you about the possible management plan. We will refer to the cancer doctor. He will be the one in better position to answer this question. You don't know. Maybe he will receive it as chemotherapy palliative, but don't say no, it's not. Okay, don't close any door. It might be okay for the scenario. If you are in doubt as a clinical judgment, just refer him to the assigned team. But don't say no, it is not, and don't say yes, it is, if you are not sure. Okay? Clear, Dr. Buckingham. So this is
Okay.
also
Okay.
for driving. This is for anything you are not aware about. It's okay, valid or no. You can refer to the assigned team. Then at the end, yes, don't ask about living wish because he came now just to know about the result. Don't expect he will have some living wish or some document advance directive. He was enjoying his life. and he doesn't
Yes, because I
expect.
thought also it is end of life care.
No.
Ah,
Yeah, so
so
don't mix. End of life is different.
yes, okay. Because in the Roch they written together. I didn't differentiate.
They put it together as a comparison, but different, as I made before, there is difference in the time, in the expected days, in the life expectancy, I mean. Even the support here, they will give painkiller only, and in the palliative, good thing also both scenario in this session to know more about the difference. In the palliative, they can give a lot of medication just to support the patient, and he might live longer. He might be depressed for a long time. They will give him antidepressant. They might give an antibiotics if he has infection, for example, because they don't decide yet he's dying. Yes, he will die in the future, but you don't know when. It might be for a longer time, years even, sometimes with years. Okay. And the end of life care means they will end the life, but in peace. They will let patient die in peace. Maybe minutes, hours. If there is support, they might withdraw the support. I mean, circulatory support, some medication to raise the blood pressure, some medication to infection. They will not continue antibiotics. In the end of life care, they will stop medication, and even they will stop the lab workup. They will not do the investigation. They will let him definitely or literally, they will let him die, but in peace. Okay. This is the
Okay.
main difference between both of them.
Okay,
And the
doctor.
good thing that both scenarios has a difference. In this meeting, we did both scenarios.
Yes.
But as a beginning, good, Dr. Bakinam, you did great. And
Thank
keep
Dr.
up.
Bakinam, I forward
Yes.
the picture for you in the group. It explains the difference between palliative and end of life.
This one? Okay, I didn't see.
Okay.
On the group? Not in the chat. Okay.
No, in the group, yeah.
Okay. Thank you, Dr. Salma.
Okay.
Very good explanation and very good case.
Thank you for
Okay,
you
thank you,
also.
Dr.
You give me the
Yeah,
chance to practice this end of life care. I was hoping to practice this online. I learned too much today from all of you. Thank you so much.
Try to put all scenarios in your schedule and to practice it as a surrogate or as a candidate.
Yes.
Even if you are a surrogate, you can do it and you will learn from it. So don't only wait to do it as a candidate. Okay?
Yes.
Because you will raise the concerns and you will know the answer. And you will correct the candidate in front of you if he practices, for example. And the next time you might be the candidate. So try to make a schedule for yourself, what I practice and what I miss. Try not to miss any topic. Please do all topics, because you to be ready in the exam to face any scenario, you have to be ready with this practice. Okay.
Okay.
Thank you. Any
sorry, just I have a question.
Yes. Yeah, this is Dr. Mayana. Hello.
Yes, doctor. I just
Yeah.
have a question.
Go ahead.
Yes, regarding this palliative, do we need, or if the patient asks for the management to say this is the myth just by ultrasound, or we need to do further investigation just to confirm, or to take it like just it is myth and so on?
No, it's confirmed, so it's confirmed, yeah.
Allow me, Dr. Basim. Yes, there was some debate about this scenario, that it is uncertain yet. I heard this debate before. Yes. Yes, I understand your concern. Yes. So
it was considered like an uncertainty, because we need to do, for example, triphasic CT scan to confirm if it's a myth or not.
Let us talk about this debate in the perspective of communication. In this scenario, in any scenario of communication, you are a doorman. You just take what has been given to you in the scenario. So in this scenario, they didn't say that it is sure metastasis from multiple myeloma. Dr. Basim, just read the scenario again. He was diagnosed to have malignant melanoma 10 years back and removed completely, then discharged back to his GP. After 5 years of follow-up, now referred with right upper quadrant discomfort, not responding to PPIs, and recent loss of weight. A liver function test shows cholestasis, and ultrasound shows multiple lesions in the liver, and also para-aortic lymph node. So we as a doctors, we know this is metastasis, but the scenario didn't say for sure. So to overcome this problem, you can just say that it could be metastasis from your, be uncertain for a little. It is mostly considered as metastasis from your old cancer, but I don't know how to make it.
Yes, Dr. Salma. Even there is one concern. Will ask you, are you sure this is just a cancer? It can be other possibilities. That's why I asked from the start, because I was confused with this uncertainty. Or
I saw your question. I saw your question. Yeah. What do you think, Dr. Basim?
Yeah, we had this conflict before, and once it's written in the scenario, lymph node and liver, and there is background of cancer previously, so it was
A
decided to be
metastasis.
as a metastasis, yes.
Yeah.
If they mention that, if they mention that there is there is possibility or some words means it's still not confirmed, they will tell you it's not confirmed. But if they wrote this is a metastasis or lesions and there is cancer, so it's related to the cancer.
I think
If they
it's more
want
safe
as
to say it is
uncertainty,
a metastasis. Yeah, Dr. Umayma. I think it's more safe because if you say uncertainty, you cannot talk about palliative and you will fall in the
exactly,
same
yes,
mistake,
yeah,
which make that candidate fail the
yeah,
exam.
exactly,
Because she
yes,
considered it as uncertainty and talk about breaking bad news, explain the news. She didn't mention palliative because she considered it as uncertainty.
yes,
If you consider it uncertainty, you will miss the palliative and you will unfortunately get low score. So it's more safe because it is metastasis. Yani from where
yes,
he will have
yes.
multiple lesions in the liver and the lymph node also. From
And
where?
they will
So,
write
so
for
if,
you, they will write for you also,
yeah,
there is plan to repeat CT or to do further work up
Mhm.
to confirm the metastasis or to
Mhm.
confirm the diagnosis. But here
Yes.
it's clear that it is already confirmed and you are going to explain the palliative therapy.
Mhm. Mhm. They are being vague because they want you to go into trap of not mentioning
Yeah.
palliative. And this is the
Mhm.
problem. This is the problem.
Yes.
Good evening, everyone.
Good
Hello.
Yes.
evening.
How are you, Dr. Dalia?
Hello,
Yes.
Dr. Dalia.
It's I've just joined you, all of you, just maybe 5 minutes ago. So I've read the
Scenario.
scenario. So
Mhm.
it's just only ultrasound, but as you've said, it's a multiple lesion, okay, by ultrasound, and liver function they show cholestasis, and so I personally I could say high probability this is a spread of cancer. I couldn't say jargon words like metastasis, Dr. Salma. Try to, you've repeated many times, so be careful, okay? So you
Yeah.
said you need to say this is a high probability that is spread of your cancer. So
Okay.
need to do yeah, that is something serious. You break the news like, I don't have good news for you today. What, doctor? Like the same, but with some just hint of that we need to confirm that. Okay.
Mhm.
So I will say I don't have good news for you today. It's the show that there is a spots, multiple lesion on your liver. That's the organ is sited here in your right side, and there is also there is gland, a large gland. That means that it's something that is more probably from the cancer, but we need to confirm that we need to do workup for that. So we need to do CT scan. So with contrast. I mean, we wouldn't say that for the patient, but this is usually what happened, yes? So I need to do CT scan, and from the CT scan, we could see that it's a cancer, okay? And yes, the final confirmation is biopsy. So I will just prepare the patient that there's something is really serious, that we are thinking about cancer. Okay, but we need to confirm that. Okay, and I guess your friend might that because usually this kind of patient has a concern of asking what's the treatment, is there any treatment if it's cancer or something, and because she feels that she's uncertain from the start, she didn't mention palliative, but that's usually it's full of concern from the side of the surrogate. And he tries sometimes to just to tease you to speak, and some people think that if not written palliative, I wouldn't mention it. So if I will say, if the investigation after they do a follow-up, I will let you know that the plan is to do CT scan, and after collect the result, and we'll have of the CT scans, we'll do a meeting with multiple specialists. I will see your result, and we'll draw up the plan for you. And usually, if this will ask you, she will keep ask you, do you think if it's cancer, what you will say? Actually, if this is a cancer and this is the spread of cancer, the treatment we call it's palliative. That our intention is to treat the symptoms and improve the quality of life. Just a brief about that, and that's it's like that. You just do the task in a way that is still not confirmed, but with high probability, and that we need to do MDT meeting. We'll say meeting with multiple specialists, okay, to look at your result and to draw up a plan for you, and so on, so on, so on, so on.
So let me just rephrase it for you, Dr. Daria. So I will mention to the patient the results for the investigation, that there is a lesion in the liver, there is a lymph node and everything. And then I will tell the patient what we are going to do now is a multi-specialty team will review your results and make sure if it is your cancer coming back again and spreading more into other organs or not. And in this situation, the management would be what we call it palliative, like this. I will tell the patient like this.
Yes, yeah, we'll do CT scan, we'll do CT cap, okay? So we'll do CT scan, yes, we'll do CT scan, and we'll do a scan. We'll say a scan.
A scan or imaging
to visualize this lesion
yes.
in more details. And usually from the CT scan, we'll have a better view that is if it's a spread of cancer, okay? And then result will be discussed with multiple specialist team, meeting, and to see what is going on, and we'll update you, and we'll share the plan. Please use share the plan of management with you, because this is now it's marked on the mark sheet, so try to use it. We'll discuss this plan. We'll discuss your plan of and we'll share the plan of management with you. Okay, and she will keep asking, is it curative? So it's from the start. You wouldn't keep talking. No, the surrogate will stop you, and they have concern.
Okay.
According
to the concern, I will answer.
Yeah, you will answer. So from you and from and play the game of answering the concern. Yes.
Okay.
But in this way, Dr. Dalia, now it's the time to talk about uncertainty, the image, the scans, I don't think we have time to talk about both tasks, either palliative or confirming the diagnosis.
Okay.
So I think the scenario will be either clear to talk about palliative and the diagnosis is clear, or it would be as uncertainty from the start and you will not talk about palliative. So either this or that cannot be together. As uncertainty, and I will confirm the diagnosis, and we will give you the palliative. So how I can
Okay.
collect all
Okay,
these
Dr.
ideas
Basim,
together?
I got you. Okay, I just I want to say that with any case of advanced cancer, whatever it's confirmed, not confirmed, whatever, it's the same thing, because if not written in your if it's not written in your task, talk about palliative, that means you need just to say brief, it might be one sentence about palliative. So you have time to say that. Unless it's written in your task, speak about palliative, you need to talk the whole, the mentor that taught us about the palliative. Okay. But usually if you don't, with any case of any disease or any condition, you have to have a plan of management, if it's written on the task or not written. No communication without plan of management.
Yes.
So in such case, just a breaking bad news. We have this. The result showed blah, and with sympathy and empathy and so on. And the whole game, it's from surrogate. The surrogate will hit you with the many concern, one after one. Okay, so the main thing is to explain what is written, your task, and to put the plan of management. And if there is any, I'm pretty sure that it wouldn't change anything. I don't know. I will explain just that breaking bad news, that it short, and then I will try to sympathy and empathy. And I don't know how the surrogate will react. He could reject that and try to say no, I'm not. This is not my result, or no, cry or not cry. I'm not sure about, but the reaction of the surrogate. Okay, so we have time, and just don't put yourself in in just a line, because it's the driver is a surrogate. You just, I don't know, after time we will feel that.
I understand you, Dr. Dali. This is the second scenario. We have the same debate, right, Dr. Basim? Second scenario.
Yes.
Yeah, the same
Exactly.
debate. Yeah. The other scenario also, we agreed that we will talk about plan of management after breaking bad news, and then
Yes.
we will touch the palliative in the plan of management.
Yes.
Same what Dr. Dalia is saying. Yes.
Okay.
Hopefully
Okay.
the scenarios will be
Will
more
not
clear.
come. Will not come.
Yeah.
Yeah, this is, by the way, this is the best and sure approach for this scenario. If you have this scenario, you're lucky, because this, just breaking bad news, and because there is nothing mentioned that talk about palliative, you just give a hint. So the plan, if it's after confirm that and discuss, and they found that it's account confirming that the cancer, so the plan of management will be what is called palliative treatment. So this is not, I wouldn't mention this unless I mentioned the MDT meeting, and they'll discuss that and will share with you the plan of management and so on, so on, so on, so on. And he will ask me, then I will find something to say about palliative, just a sentence, that the intention is to treat the symptoms and improve your quality of life. And it will let you know about what kind of palliative treatment that you could. And after he asking, I wouldn't confuse the patient of lots of information together, one by one.
Okay.
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 Clear
Thank
now,
you,
yes.
Dr. Daya. Yeah,
Thank
thank
you.
you. Okay. Again, as Dr. Marwa said, I don't agree with this opinion. It's hidden agenda for palliative. So again, let's assume the scenario will be clear and the task will be clear. If not, please don't do it. Yeah, as
Dr.
Dr. Daya
Basim,
said.
okay,
Yes.
I need to do, okay, I need to share my
Yes, sure. Go
experience.
ahead. Yeah,
Okay.
sure, Dr. Marwa.
There is one scenario came to my recent exam in this station. It was communication. I took my mark was 13 out of 16. The patient, it was because as Dr. Dalia said, sometimes the scenario will not mention clearly that there is palliative care, but also there is debate how to deal with this case. This case was about 65 years old. My task is to speak to her daughter because this lady, she had advanced stroke with morbid weakness and with severe weakness, and she developed. She was on NGT feeding. Then after even NGT feeding, she started to have pneumonia, and written in the scenario that she has fever, and the consultant decided to keep the patient MBO and starting the treatment for pneumonia. Okay, I didn't. Some of my colleagues, they told me that they mentioned in this scenario that the patient will be palliative care because the stroke is advanced, and now there is she is even after NGT, she is developing aspiration pneumonia, and they mentioned in the scenario palliative. For me, I didn't deal with scenario as palliative. I mentioned the scenario as they written in the
Option of
scenario.
feeding. Yeah.
Oh yes, that there is this stroke. She was is a daughter. She was speaking to me. Usually, why you are keeping my mother MBO? How she will take her feeding? I told her that she will receive her feeding the same, but through her blood channel, and this is in the best of interest of her condition. Because the stroke in this in the condition of your mother, I'm sorry to tell you that sometimes it will affect some muscles in our body and affecting some muscles and the ability to swallow. And so she developed bug infection. So and she told me that after that she will be discharged. How she will depend on IV fluid. Also, I said to her that in that at the time being that she will receive the antibiotic in the best of interest of her condition to treat the bug infection, and there will be reassessment for her ability to swallow. I did with a scenario like that, and my mark was 13 of 16.
Perfect.
One of
Yes.
our colleague, she told me that this case we should mention that
Palliative.
no, it will be palliative. I don't
Okay,
know
then
also.
how much she got? Do you know? Do you know how much the score of the candidate who mentioned palliative, Dr. Marwa?
I'm I didn't because you know the group, no one
Okay,
passed the
you
exam.
didn't ask.
So
Anyway, for me,
I didn't ask.
for
What about you? Yeah.
yeah, for me, if you get 13 out of 16 means you got the mark of pass. Okay.
Mm,
So
mm,
what you mentioned, I think it's perfect. For me, I will do the same. I will not talk about palliative. I don't know for the stroke residual,
mm,
and I think this is the acute state of stroke. I cannot judge
mm.
on the further plan by myself.
Yes. Yes.
I could
Even
say what you
if
mentioned
she asked
exactly.
she asked me many times, will my mother improve? Or I told her that no one can expect.
Perfect. Yeah, this is
Yes,
the
it
best
said,
answer.
yes, it is different from one patient to another. But
Mm,
what I want to say now is that the stroke affecting certain function including swallowing and leading to this bug infection. And
yeah,
then, based on the rest of her condition, we will follow the consultant orders and we will follow
perfect,
her. Yes, okay. She will be under our eye, and we will take care of her and taking full supportive care, and we will reassess her after
perfect.
finishing antibiotic, and we'll assess the response to antibiotic. Even she told me, she, is she will not, يعني, there is the sorry يعني, is there is the she may not be response to antibiotic. She told me like that. You
Yeah,
mean
we don't know
I told her, yeah, yes, I told her that we don't know, and the progress of
exactly.
condition different from patient to another, but
Perfect,
she will receive the full supportive treatment and full care, and she will receive these medications in the best of interest of her condition. And after that, she told me about discharge. I told her that we will involve also physiotherapists after stroke,
perfect.
and we can also involve even if she has not, there is no support or no one asked about the support in her house. We can receive rehabilitation. I told her
Occupational
social
therapist.
workers that, yes, occupational therapist. I told her all about that. I don't know, but
I
I
believe
mean,
Dr.
many of our colleagues, they told me, no, you should
No, no,
mention palliative. I
no.
don't know.
I don't think.
Ah,
I
okay.
believe if the point or the task was about palliative and you didn't hit it, you will not get the 13.
No,
Okay.
yes, I trust. Yes, I think
Yeah,
yes.
13 for me, 13, like you pass and you get some marks deducted by borderline from some
Yes,
examiner, not all examiners, in some
yes,
skills also, not all skills.
yes, yes, yes,
So
yes.
for me, you did perfect, and what you did, this is the task. So it was like the options for the feeding, how to give the feeding right now and how to give the feeding in the future.
Oh,
You
yes,
have been
according to
in the
his
middle.
improvements, yes. According
Perfect.
to the
You
professor
said, yeah,
condition.
you said in the now we will change to IV fluid. Maybe if you hit the point of big tube, if she didn't swallow well, you get the full mark.
Mm,
This is the task, and this is the full mark point. If you mention if she had planned difficult swallowing in the future, we might
mm,
do what's called big tube, and at least
uh-huh.
one sentence about
Mm,
the big tube. It's a procedure through the tummy wall to
yes, yes.
provide the feeding. Apart from this, we don't know what will happen. We will reassess, reevaluate. This is my opinion again. But 13 for me, you pass this station. So the palliative, if the task is a palliative, you might get less than
Less mark.
10. Less than
Yes,
10,
yes,
exactly, yes.
yes,
So I
yes.
believe you did the perfect thing.
Mm, okay, thank you.
Well done, Doctor. Well, inshallah, hopefully for next time you will pass. Inshallah.
Inshallah.
Okay, any question else or any opinion? Dr. Abdullah Hisham said, when to ask about advanced directive and lasting power of attorney in these cases? Yes, I did video also about the lasting power of attorney, when to ask about them in the progressive disease. And the patient has long-term disease which is worsening day after day. He's suffering motor neuron disease. He is bedbound. He's not improving. Cancer, advanced cancer, diabetes with long-standing complication like nephropathy on dialysis. All these points or all these cases, you might read this issue. Okay, score 13 means she was on right way. I believe it was in the right way. Yes, Dr. Rashid said. Perfect. Okay, let's go to Dr. Buckingham. She asked me earlier about 3 questions, Dr. Buckingham. Are you there still? I
Yes,
hope
doctor,
she's still
I'm
with
here.
us. Yeah,
Yes.
tell me one by one, which scenarios you want to talk about first?
The scenario was bit sores. Okay.
Yeah, bit sores
Uh,
with a stroke, right?
yes. And
Okay,
she, in the scenario written, that she is transferred from the stroke unit to the ward. She's improving, but she has the ulcer, the
yes.
sores.
Okay, let's make it as after all precaution, we try our best, but still the bit sore might happen. So it could be, there is possibility to be like error, okay? And some mentors mention it is an error, whatever, it shouldn't happen. Till now, as the conflict still not solved for me, but I asked one examiner in the cases clearly about this. He said it's an error. The bit sores shouldn't happen in the hospital. Okay.
Mm,
But
okay.
some doctors, mentors said maybe even with the full care, because of the friction, because of the sampling, because of touching the hard surfaces, it might happen. So try to be strict to the scenario. If the scenario going, you feel the scenario is going more with the error, make apology once only and proceed
Mhm.
with the other steps. Okay. We will notify
Okay.
the nurse to take care. We will do some change in the mattress. We will make air mattress. These
Mm,
things might help not to have the sores again. And we will have the wound care nurse. It's a specialized nurse. She will follow your mother to take care of this care source in order not to be worse. Okay, this is the first. The second,
معلش
the
دكتور
second
باسم
yes, yes,
معلش دكتور باكر
yeah,
بس
definitely.
regarding الكيس اللي قالتها ديت ممكن هي تكون more as error لأنها within
Uh-huh.
1 week only it happened صحيح
Yeah.
ولا إيه يعني if
yes,
it is
1 week,
within
right?
just
So
short
yeah,
period of
again,
time I think it will go more with the error.
yeah. So again, follow your sense. What you feel, follow it. Is 1 week? Yes, you are right. It's supposed not to happen. Bed sores sometimes, I believe, some families at home they take care of the bed sores to the level no bed sores if they visit the hospital. Okay,
Yes, you're
and
right.
some yes, really, and in the hospital, 1 week or 2 weeks, the patient will have bed sores. So what happened? Do you think that the family knows about the nursing care more than nurse itself, or the nurse herself, or the staff
No, they
themselves?
caring more. They are caring more.
I know they are caring more, but so supposed not to happen.
It's
So
supposed not
it's
to
an
happen.
error. Yes, exactly. So I go more with the error. But some mentors said even with the it's not happening. Suppose not it might happen because so I go my opinion to go with more with the error. Okay. Thank you, Dr. Ma, for your
Okay.
opinion.
Thank you so much.
Dr.
Excuse me.
Yes,
Yeah,
Dr.
could I
Dalia.
add? Yeah, I
Yeah,
have
yeah, sure.
2 points. Yeah, for the case of I asked my consultant about this if it's bed sores on the ward, is it a medical error or not? He replied me clearly and frankly, mostly it would be an error, but usually when you answer such a scenario you was like احنا بنقول بالعربي تمسك العصاية من النص. Okay, and how could I play that game? So you apologize, and at the same time you need to inquire about if they apply or you will check with the nurse in charge with all the stuff that it's everything is going on as it should be, and it's like uncertainty. You want to investigate at the same time you apologize like an error, but wouldn't go deep, as Dr. Basim said. It's like an error, and to take it seriously that it's an error, and because you don't know what had happened, who is doing that, and you apologize as a medical team that happened in the hospital, and then you will see. I will check that with your team what had happened, why this patient has as like still yeah the team has a responsibility, a duty of candor. Okay, so we will you play it like, because there is no you mostly it's an error, but at the same time you will play it like that. I don't know, he just explained that to me, and that you apologize and you say sorry for that, and we'll investigate about that and we'll see, and you know you will play it, but not fully like an error. You need to investigate and to see and how is that happened. At the same time, we will do our best, and you will mention the plan of action, but you didn't mention that we will do incident report, and
But
I, th- th-
in real practice, Dr. Dalia, one time if you notice the bed sore, we should notify it, right? The nurse is notifying whenever they found there is bed sores developed. I
yeah,
don't know. Yeah, it's again, it's debating scenario, but still going more as Dr. Dalia said, it's more with the girl. If you can add the sentence of we will do some investigation to be sure that it's everything was okay or something was missing, it's okay. You can do it as Dr. Dalia said.
yeah.
No harm to
You
say
could,
that.
yeah.
Yeah,
The
yeah.
only thing you could not mention the incident report. You know that. That's the only thing
Okay.
you
So
couldn't
we will.
mention. You play it like not to say incident report has made an oh no, it's you said it's like I apologize that we will look for that why the patient, and we'll keep caring of him. Okay, and we'll do our best to help him. Everything like a plan of
Yes,
bed
yes.
sore management, and will make sure that the whole team he's just do the all
Yes.
the rules and I mean the instructions. Okay, for the previous scenario about the patient with stroke, it's usually the word that might be missed for any patient with stroke, the rehabilitation program. So if a patient with stroke and he developed aspiration pneumonia, so the plan of management for both lines for the pneumonia, yeah, that I need to mention for the plan of management, yes, the treatment of pneumonia and the treatment of stroke. So for the stroke is rehabilitation program. We usually wouldn't name it like palliative. We say it rehabilitation program. So the rehabilitation program, what I need to say that I need to mention the speech and language team or therapist, and especially you need to involve the physiotherapist and the occupational therapist and all the team. Okay, so we take care of his feeding. We take and for this patient, we need to give him at the moment, I guess for MPO because he's despite his NG feeding, um, he developed the aspiration pneumonia, and this is I wouldn't say if you change to if you change to the I don't know, it's the word is okay. You've mentioned that, Dr. Basim, that gastric, yes, gastric tube, yes,
Big tube, yeah, yeah.
big
You mean
tube,
big
yeah, the
tube.
gastric
Yes.
tube. And if you mention that, by the way, even with gastric tube, the patient could develop aspiration pneumonia. So even with gastric tube or big tube, he could develop aspiration pneumonia because from the saliva, he could just go to the wrong way. So I prefer not to say that because could happen even with peg tube, with NG feeding, and okay, but to minimize the risk of aspiration pneumonia. When you explaining this kind of big tube or NG feeding and all, you didn't say that for guarantee that patient wouldn't develop aspiration pneumonia. No, we will say usually that to decrease the risk of aspiration pneumonia.
Exactly. And I think the chance of having aspiration with big tube is very, very few compared to the NGT itself.
Unless it's in the wrong way. But even with that, because the saliva itself could go to in the other direction. Okay.
Yes, I
So
agree with
yeah.
that.
Even
But
from the stomach, it can go back.
yes, it can go back if the stomach is full, but the NGT itself make some discomfort to the patient and he's not able to spit any saliva. I mean for the NGT, but for the big tube, it's far away. Unless he has vomited, he will be aspirated. But for the NGT itself, it might be triggered to vomit, and he cannot protect the airway, so he might be aspirated more chance than the big tube.
Okay.
That's why
Dr.
we are
Basim?
going with the big tube, right? We are preferring big tube for the long-term patient with difficulty to swallowing.
Dr. Basim, just and
Yes.
one question before complete this. So I get from Dr. Dalia that if the scenario about stroke, it is rehabilitation that we should mention in name. We should mention, not palliative.
Yes.
That's
No, no, no
why the
palliative
people
rehabilitation.
feel
Yes. Yeah,
it is
I
not
believe
palliative.
yes. No, no,
Yeah,
no, no
so
palliative here. No, it's rehabilitation.
rehabilitation and explain the rehabilitation for the patient just.
Especially the SALT team, SALT, speech
Yeah,
and language therapy.
speech language. Okay, okay.
Yeah, go ahead, Dr. Del.
آه،
Anything else you want to add? Dr. Rashid, yes?
دكتور
No, thank you.
سلمى السيناريو بتاعت for this melanoma I saw it
Yes.
a bit in another way يعني my patient missed follow up or GB didn't offer him follow up. There is a clear mistake or clear negligence. أنا عارف هما كل مرة زي changing the build of
Not,
scenario.
not a changing. There is a scenario of the same idea, but sometimes as error, and they brought
أيوة
it.
they are changing on the build of this.
Yes, they are changing. The same idea of
you
paracetamol.
mean
but
error from the GB يعني, not from the hospital?
It was clear in mention إنه they
Yeah,
didn't offer him follow up, regular
It's-
follow up like that. So the recurrence it happened again.
Yeah,
Like,
so if it is from the GB and mentioned in the scenario that he missed appointment or he was not following up or something, it is still not medical error.
no, the patient himself or the doctor.
didn't inform me يعني إنه for follow up يعني nobody guided him for follow up.
No, he will tell you that nobody guided me
Yes,
for follow-up.
yes.
Yeah,
It will be from the
Yeah,
doctor side, not from the
but
patient
it's,
side.
and from the doctor side, from the GB side, not from the hospital.
Yes, from the GP side.
So still, we will not play it as medical error, right?
No,
We will, yeah,
if
we
there
will
is
tell that we are sorry for what happened.
No, it is medical error. It was negligence.
error. Yes, negligence.
Even if it is from the GB side, because you said that he will tell you that the GB didn't tell me about the follow-up and I didn't do the blood thinning test. That's why that happened to me, right?
Mention in the scenario, stated in the GP or the hospital, they did not offer him follow-up.
Yeah, okay.
After
so it's
resection,
clear
they let
error.
him go home like that and
Yeah,
nobody
clear.
called him back.
So you will apologize. You will apologize on behalf of the
Apologize,
team.
yeah.
Yes.
I have still problem with the scenarios when it is stated that the problem happened from the GB side or from the hospital side. What I come to know that if it is clearly mentioned in the scenario that's a medical error and the hospital did not inform him, I will activate the duty of contour. But if he said that they refer me to the GB and the GB didn't tell me about the follow-up and he did for me the test, then the answer will not be the duty of contour, right? I will apologize for what happened to him just.
Yes.
And then I will tell him that I will see your file and
Exactly.
our team will
Yes.
investigate further for this. Okay.
Exactly. Yes.
You're right.
Yes. Okay. Then the next scenario, Dr. Bakinam.
Yes, doctor. The other one was endoscopy and perforation of esophagus, and he make a consent about that, and they want another consent.
The tear, right? The tear.
Yeah, because to fix the tear, and they write in the scenario endoscopic and the surgery.
Yes.
Or surgery.
This is complication, not error. Yeah.
Complication. أيوة.
And it's
What is the
consent.
difference?
Yes.
Complication or consent, right? And what is the difference between medical error? Because a lot of doctors say it is a medical error, not a complication.
No
Okay,
medical
and
error.
the definition of medical error.
Medical error, something clearly happened and shouldn't happen. Okay, shouldn't happen. But the complication, it might happen, and it would be one of the possible side effect of medication, side effect of surgery, procedure. It's clear. It might happen, even few
Dr. Bassel,
percentage.
I think in this case, if they did all what necessary before the procedure, okay, patient is fasting and they give muscle relaxant or sedation and all these things, and despite of that, the tear happened, I think this will be a complication, okay?
Yes, exactly.
Yes, if anything missed, okay, it will go to a medical error.
No,
Exactly.
according to the condition also, Doctora.
Again,
The condition
it shouldn't
advanced,
happen.
delicate, esophagus not, what I
So-
can say.
So you can say it shouldn't happen. Anything shouldn't happen. This is an error.
No, Dr. Basim. No, just a minute. If the scenario stated that the patient consented and he has a consent, but tear happened, what Dr. Bakinam said.
This is
If it is informed
complication.
consent, yeah, it will be a complication.
It will be a complication because in the consent, they will explain to him the side effect of the endoscopy, that bleeding could happen, infection could happen, and injury to the organ failure of the operation. And then he signed it. So you will tell the patient that if you are speaking to the relative, your father already signed the consent. In this consent طبعا in a sympathetic way, not in my way, I'm just telling you that he filed
to the patient,
everything explained to your father before the procedure, and he has been informed about the expected bad outcome that could happen. One of them is what happened. Unfortunately, I am sorry to tell you, it is a rare complication, but it can happen, and it happened to your father. We are sorry for what happened to him, but this could happen. Just you are sorry for his condition, but not for any medical error. This is a complication. But if the scenario mentioned that it is
no consent,
not consent, and also
this is an error.
And also, my debate is if the patient is coming in emergency and he was loss of conscious مثلا, and this endoscopy done in emergency situation, what we will do in this case?
If no capacity, no error. If no capacity, patient
it is a medical decision in his best interest. Also, you will defend yourself. It's a medical decision to save his life, but one of the complications that could happen, rare complication, but unfortunately it could happen, also the same scenario. It is a complication in both ways.
Yes.
I think we have to inform the next of kin if the patient came in an emergency situation. We have to inform the next of kin, okay? They have to take a decision on his behalf, okay? If they decline that they don't want to do any surgeries or anything against the patient's best interest, we have to go for a medical decision. Even we have to involve what we call that legal, I think after involving the consultant and all these things, and after that we will involve the legal advice.
We had a deal about this. Any procedure related to the patient, apart from life-saving, the patient himself should sign it. You are talking to the next of kin just to give him idea, but you will not get consent by the next of kin.
No, if he lost his capacity, if the patient
if
unconscious,
he lost his capacity, medical team.
Yes, doctor. Not like the practice
consent.
here. Doctora.
Different than the practice here.
Different
here
than
we are taking consent.
No,
in Europe, they are not following that. We updated that recently in the group. We wrote it clearly.
I think
like LP, lumbar puncture. If the patient himself didn't sign, so no need for next of kin. Unless he lost the capacity, the medical team will do it in the best interest of his condition.
I think Dr. Basim, and correct me if I am wrong, even if the patient has advanced directive and the operation is life-saving, in this case, you will just go to the legal issue. You can also do the operation in his best interest, even if he has advanced, he signed a paper not to do anything for him, right?
No. Advanced directive different. No.
In this case, we will not do.
I think the point explained by Dr. Dalia before this point.
Okay.
If you remember.
Advanced directive, same like a patient with capacity.
Yes, you
same.
Yes, I asked you this question before.
Okay. So
good that I asked.
If advanced directive said I wouldn't want to be treated by lumbar puncture or any procedure, don't do it.
Yes, this is the strongest. Yes.
Okay. This is like a same patient with capacity, advanced directive. And if it's the patient lost his capacity, and for life-saving thing, as we just inform that it's like a best practice is to inform the next of kin that to update him about what the situation and is his blah blah blah, explain that
without consent.
And without the next of kin never ever do consent for anyone.
Even last power of attorney, you said also.
No, lasting power of attorney could, if the patient has lasting power of attorney, they could do that with him if it's not life-saving. If it's life-saving, it's a medical team decision. And if against the next of kin or lasting power of attorney against you, you will involve your consultant that to raise it to the legal team of the hospital.
Yeah, it is clear now
Okay.
for me.
Yes,
Yeah, it is
yes.
very clear now.
So
Very clear.
don't
Yes.
go in
Yeah.
confrontation with the
Mhm.
if even it's your right as a medical team to take a
Mhm.
decision. Don't
Okay.
take a decision before you know, just put your consultant on. If you have any scenario, yes, we will form in consultant after you ask why and try to solve, to explain things and to try to negotiate and to find solution. If it's still the patient or the next of kin refuse or reject that, just involve your consultant.
Okay.
Yes.
Okay.
Yes,
Yes.
clear now.
Clear
Yes,
now.
thank
Clear.
you,
Very
Dr.
clear.
Dali.
Okay.
Thank
you,
you
Dr.
for all
Dali.
of you.
Yeah, thank you,
Assalamu
Dr.
alaikum.
Dr. Alaikum Assalam, Dr. Rasha, yes.
You mean in the life-threatening condition, the medical team decision?
Yes, exactly.
Okay.
And you are informing the family about what happened and what you decided, not to get a consent at all. Make it as a rule, okay?
Okay. Okay.
Thank
Team
you.
decision unless there is advanced directive.
Unless that advance directive, so you'll follow the advance directive. Unless there is lasting power of attorney, you will have a meeting with the legal advice to see which is in the best interest of the patient.
No, life
Yes.
saving. You cannot follow.
Okay, life saving. Yeah, life
Yes.
saving is
Only
okay.
there is the advanced directive. You
Even
can
the
follow the
patient
advanced
had lasting power of attorney, even advanced director, even the medical team decision.
Yes,
Yes.
life saving.
Yes.
The life saving, yes.
Yes.
So let's say it's as a general or any life saving, we will go with the medical decision unless he has less advanced directive, he doesn't want this intervention.
Yes, only this one.
Only this. Okay.
Mm-hmm.
Then the next, thank you, Dr. Asha, for the question. Dr. Buckingham, the last concern.
Yes, doctor, this was
Okay,
the
this all?
conflict about the
Okay.
definition, yeah.
Are they clear
Also,
now for you?
sorry, this I remembered. The
Okay.
PCI case, okay?
PCI,
Also,
percutaneous coronary
PCI.
intervention. Okay.
But
What's the question?
but failed, and
Okay.
he passed away, and it was done
Okay.
in emergency.
Yeah, catheterization. So this is
Complication.
post-mortem.
Yeah.
Corona.
Yeah,
Complication
but
also.
the communication, but
Complication,
the
and you
hidden,
will break the bad news and
Cor-
sympathy embassy.
Corona
but
also. Corona here.
coroner, yes, this
Corona,
is the
yes,
hidden,
corona.
Coronary,
yes,
yeah.
coroner. Yeah, this is
Within
the
2 days.
Mm.
on table, any procedure on table, this is unexplained death. You have to raise the point of coroner. Not only within 48 hours, no, even he's admitted, okay? Patient admitted for acute abdomen or for chest infection, and he has occasionally acute abdomen. And they took him to OR as life-saving to operate him. And he did on table while doing the surgery. This point also this scenario raised the coroner why he did on table. Why he shouldn't die, right? He shouldn't die while doing the surgery because patient went to the OR to do surgery and expected to be back with no complication. At least he will go back to the surgery, the ICU or whatever. But if he died on table while doing the surgery, this is also a point of coroner. So coroner, any death on table, either BCI or catheterization on admission or even in the hospital. But this scenario is not coming, by the way, the surgery. But this is what I remember. Any procedure or any dying table should be raised as coroner. And any patient die within 48 hours of admission. Patient admitted with the confusion and he died, and we don't know what happened exactly with him. So we should raise, especially unexpected death. Young patient, he came with the confusion. Why he did within 48 hours? It's not expected to die. Patient 30s, for example, came with the confusion. After a couple of hours, he died. So it's not expected. At this point, you will raise the coroner. Okay.
Okay, Dr. Basim.
Clear?
The scenario
Thank you, doctor.
I did 2 days ago, it was pneumonia, and he was improving, and then suddenly
Okay.
today he died.
Okay. Uh-huh.
Yeah, I did it like coroner also.
Yeah, so it's unexpected to that. And also
Unexpected.
maybe
Yeah,
within
because he was
48 hours.
improving. Yeah.
Yeah.
And then the
This one
same
was
day.
a heart attack also, right?
Yeah.
MI.
Yeah. Yeah.
Okay, clear now all scenarios and debates, Dr. Bakinam.
Yes, doctor. Thank you. Thank you for
You did like a
explanation for all
revision
of
of
you.
most, yeah, you did like a revision for the most high yield topic in the basis.
Yeah, high yield from the
Yes.
first
Yes.
session.
Yeah, really,
Yeah.
really, this session is very
Thank
nice
you.
and
Thank you all.
informative one. And the point you
Yes.
raise is also nice to be discussed and to clarify the things. Thank you, Dr. Dalia, also for sharing the opinions and sharing the
Yes.
ideas
Thank
with
you,
us.
Dr. Dali and Dr. Salma.
Yeah, thank you.
Thank you.
Any concern or any doubts again?
سؤال بس يا دكتور باسم.
Yes.
For this hemochromatosis معلش time is allowed. يعني ايش الكنتة بس يعني نعرف as we said this scenarios nowadays appearing in many places. What is the secret behind this? Any specific hidden يعني agenda for this? I don't know.
Hemochromatosis as long or as communication?
لا, as communication.
What about hemochromatosis? What's the topic? Hemochromatosis and what? Okay, if you can send me the scenario and we can
Maybe this
practice
is
it.
counseling.
Counseling? I don't know, Dr. Rashid. I didn't hear about hemochromatosis and communication
I will
before.
send it, inshallah.
Yeah. Okay, send it to me and we can practice it in the next session of communication.
Right, okay.
Okay. Okay. Thank you. Thank you, Dr. Dalia. Yes. Thank you for your ideas and opinions. Thank you, Dr. Maha, also. Yes. All of you, your comments are precious for us and always justify and clarify the things. So please don't hesitate to share. Don't hesitate to verbally communicate with us. It gives you the confidence how to present, how to practice, how to be ready for the exam. Really, the exam stress is much than you expect. But if you practice a lot, you will overcome this stress. So again, I encourage. Thank you, Dr. Bakiram, for practicing first time. Hopefully tomorrow we have the first session of doing the clinical short cases. Anyone have the videos, past test account? It's much better to show the videos while doing the examination. I can share or I can make him the host. He can share the video. So all of us will get the benefit seeing this video, watching it together, and picking up the finding while watching or hearing the finding by the records. I hope the candidate will be ready with this. If not, at least we can discuss about the case itself. So, for example, obstructive lung disease, so we can discuss about the COPD or, for example, the chest hepatosplenomegaly. We have a lot of topics to raise and to talk about. Hopefully tomorrow, inshallah, will be the first session for the short case. Hopefully all of us will get benefit from it. Thank you, Dr. Abdullah. Thank you, everyone. See you tomorrow, inshallah, with the short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.